Welcome back to the Great Compromise podcast. Here with you today is Victoria the Democrat and
GOP Jim.
Today we're going to be talking about universal health care. What is it and why is it important? So why are we talking about universal health care today? Well, I think we can all agree that in America our health care system is broken. And we're going to be arguing whether or not we should have universal health care in this country. What is it? Universal health coverage means that all people have access to the health services they need when and where they need them without financial hardship. And it's funded by the government. So let's get into it. This week, I'm on the pro side. I am pro universal health coverage. Firstly, our system is incredibly expensive and wasteful, even deadly. The Ways and Means Committee in Congress held a study in 2019 asking how well the U.S. stacked against other countries in providing life-saving drugs at an affordable cost. They compared U.S. drug prices to 11 other countries, including UK, Japan, Canada, Australia, Portugal, France, the Netherlands, Denmark, Germany, Sweden, and Switzerland. On average, the U.S. was paying 4 times the rate that other countries were paying for equivalent drugs, sometimes even 50 times as much. This came after insurance rebates. Our medical system is not regulated. Drug companies can spend money on huge ad campaigns and raise the price of life-saving medication because it's in so much demand. A notable example is the EpiPen. They raise the cost of one EpiPen 4 times because it is so necessary that they know people will find a way to spend about $100 on a single EpiPen because it can save someone's life if they fall into anaphylactic shock from an allergic reaction. It's only reduced to $95 after insurance. By the way, without health coverage, the EpiPen is $392. I'd like to share the following numbers with you, but let's keep in mind that these are pre-pandemic stats, so it's safe to assume that the numbers have gotten worse by now. 8% of U.S. adults skip their medication because it's too expensive. 1 in 8 Americans die because they cannot afford health care. At least 500,000 Americans declare bankruptcy due to medical bills. 26,000 Americans die every year because they cannot afford health care. In this study that I mentioned previously that was focused on 11 countries, the Ways and Means Committee showed that 0 people die every year because they cannot afford health care in every other country in the study. But in America, 26,000 people die every year. Secondly, the right to health care is an important part of a just society. The United States is the only developed country in the entire world that doesn't have universal health care. Everyone else treats health care as a social good. Everyone should be covered. In 2018, 27.5 million people did not have health insurance during any part of that entire year. Our government provides free public education, public law enforcement, public road maintenance, public libraries, and other public services to all citizens. Healthcare should be part of this list. Norman Daniels, PhD, a professor of ethics and population health at Harvard, has said that healthcare preserves for people the ability to participate in the political, social, and economic life of society. It sustains them as a fully participating citizen. During the pandemic, 27 million people lost their health insurance because it came through their employers and they lost their jobs. If we had universal health care, this would not have happened. It's especially critical that so many lost their health care while the world was going through a public health crisis. We as a country need to be doing better. Lastly, universal health care is cheaper for citizens and would save billions a year. It cuts out the middleman if it's a government program. No salaries for massive private companies, expensive ad campaigns, or money spent lobbying Congress. And it would save time in the bureaucratic process of figuring out who takes your insurance, going back and forth between doctors' offices and insurance companies. And for those using government assistance programs, they have a limited number of people who take their insurance or federal grants. This would streamline the process and give everyone a solid foundation of access to healthcare. The Organization for Economic Cooperation and Development has data that Canada and the UK, who have universal healthcare systems, spent 47% and 42% respectively of what the US spent per capita in 2017. South Korea's universal coverage cost 28% of ours that year. The University of Massachusetts at Amherst conducted a study that showed under a single payer system where everyone is guaranteed access to healthcare, together public and private spending would be lowered by $1.8 trillion over the next 10 years. This savings would come largely from lowered drug costs and administrative expenses.
Thank you, Victoria. But this time, I am against universal health care, and here's why. Let's start with the cost to this country. Research from George Mason University concludes that providing government-funded health care to all could increase federal spending by $32.6 trillion over the first 10 years of implementation. Even right now, spending on Medicare and Medicaid took up 21% of the federal budget and are predicted to reach 30% of federal spending by 2028. Those programs only cover a small portion of the population. Imagine how expensive universal health care will be. Well, we don't even have to imagine. Universal health care in Canada costs $264 billion a year. And of course, the United States has about 300 million more citizens than they do, meaning our costs would be significantly higher. And that money comes back on the taxpayer. According to Paul R. Gregory, PhD at the Hoover Institution, financing a universal right to health care in the United States would cause payroll taxes to double. Also, the quality of service will decrease. Healthcare is a problem of supply, not demand. Countries with a universal right to healthcare have longer wait times than in the United States. For example, in Canada, patients have to wait an average of 21 weeks for treatment. The average wait time to see a specialist in Canada was 60 days versus 24 days in the United States. And in the US, only 25% of patients have to wait at least 4 weeks to see a specialist, compared to 59% in Canada, 56% in Norway, and 43% in the UK, all of which have universal healthcare. Access to a waiting list for healthcare does not equate with access to healthcare, which is one reason why patients from abroad often prefer to come to the United States for treatment. Besides wait times, generally quality of service will go down. In countries with a universal healthcare system, disease treatment outcomes are worse than in the United States. The US 5-year survival rate for all cancers is 67%, compared to 60% in Canada and 54% in the United Kingdom. Annually, there are fewer cancer deaths per 100,000 people in the United States than Australia, France, Germany, Norway, and the United Kingdom. America is ranked at number 2 for breast cancer survival, behind only Sweden, and at number 3 for stroke survival, behind only Japan and South Korea. Statistics show that the United States cancer screening rates for cervical and colon cancer are higher than those in Australia, Canada, and the United Kingdom. Why would we want to downgrade our services? And lastly, who wants more government control? Countries with universal health care, including Australia, Canada, New Zealand, and the UK, all ration health care using methods such as controlled distribution, budgeting, price setting, and service restrictions. This is due to national budget constraints and a lack of supply. But let's talk about a state here that's already tried it. Massachusetts enacted legislation in 2006 that was intended to move that state to a near universal health care coverage. And by 2008, some 165,000 more residents were insured through a combination of employer mandates and government-subsidized insurance. And overall, almost 93% of non-elderly adults had coverage by late 2007. However, because inadequate or no provision was made to expand the provider workforce, many of these patients had no access to care, and costs have escalated so far beyond estimates that additional financial support is required. Is there anything you trust the government to do 100% right all the time? Of course not. And healthcare is too important and personal to allow them to have control of. The free market should determine the availability and cost of healthcare services, not the federal government.
Thank you, Jim. So one of your points was about how universal healthcare would be more expensive for our government's budget.
Mm-hmm.
My last point was how universal healthcare is cheaper for citizens. It would save us billions a year. And I think that if we were to compare the added costs that the government would be burdened with by universal healthcare and compare that to all of the premiums and deductibles that people are paying already for our privatized healthcare system, we would find that citizens would save quite a lot of money. Actually, one of my points was 1.8 trillion over the next 10 years. And with that savings, we would be more than fine to have added taxes to pay for those increased expenses by having universal health care. So we would still come out all right, saving quite a bit in comparison to the way we are now, the way that things are running.
Yeah, I see what you're saying, that because deductibles and premiums are so high right now, that getting rid of, universal healthcare would get rid of those and instead replace it with a higher payroll tax or some form of tax, hypothetically.
Mm-hmm.
It would still be a net gain for people. Is that what you're saying?
Right.
Okay. And that actually may be true cost-wise for the average person, though I can see the middle class getting squeezed a little bit. Like, we don't really know how much taxes are going to get raised, and so lower class aren't going to get hit if it's payroll tax, let's say, and the 1% or the upper class don't really make their money from income, so they're not really going to be paying this payroll tax. So it's going to rely, as it always does, on the middle class. And so my concern is, how much is that tax going to be?
Mm-hmm. Right. Well, I guess this is a little bit for another debate as far as like the 1% and income tax. It doesn't have to come specifically from income tax. It could be taxes on other things or in other ways where the 1% are being hit a little bit more proportionally than the middle class, having to carry the burden of that. So,
okay.
It would take time to see how that would all pan out. But I think overall it would be quite a savings to just cut out private healthcare systems like that.
While we're saying that, cutting out private healthcare and insurance, if we did that, that would actually eliminate around 1 million jobs in this country. Is that something you approve of?
No, but if you remember when we debated the post office, your point was that those mail carriers could be employed by the privatized companies like UPS and FedEx. And, I'm just going to bring that argument right back up here, where private companies could then be, like, the people who worked for those private companies would then be employed by the government, because we have to expand our healthcare if the government is doing universal healthcare. So it would just be more of a shuffling than a job loss.
I would imagine most of those people wouldn't be able to find jobs with the government. There's a lot of insurance companies, as you know, and a lot of different jobs in those companies. And if we consolidate all that, it's going to be, somewhat simplified, and we wouldn't need all those people doing that amount of work. So it would ultimately kill some jobs.
It might, but plenty of other countries have universal health care, and they're functioning well. I think there would be some growing pains, but yeah, like the number of deaths in the US from people that are not covered by healthcare is pretty high, and countries that have universal healthcare aren't suffering in that way at all. So I think there's a lot of good that outweighs the bad in universal healthcare.
Well, in this country, if you go to the emergency room, they have to treat you whether you have insurance or not. They are legally obligated to treat everybody.
Right.
Yes, it's unfortunate a lot of people do not have insurance, and as we said at the beginning, the system isn't working in
we
America.
Can definitely agree on that. Yeah.
That it's not working well, at least. Is a lot we can do to improve upon it, and my opinion is that we do that through the free market. Competition is king. Competition can improve it, and right now we're not even allowing competition in healthcare or insurance, and so we're running into these problems.
All right, expand on that a little bit. How would that look?
Thank you for asking, because I want to talk about LASIK eye surgery.
Okay.
As you may or may not know, I myself have had LASIK surgery. Big fan. It worked well. But LASIK is an elective surgery, so insurance does not cover it. And it's in a competitive market, and because it's expensive, lots of doctors want to do it. It makes them more money. Why wouldn't they? Years ago, LASIK used to cost $20,000 an eye. But because of all that competition, now it costs $4,000 to $5,000 an eye.
Okay.
And because of that direct competition, the costs were brought down. And I think if we allowed healthcare to have competition, we would see this more regularly. Do you know what I'm saying?
I do. So you're saying that if we allowed more competition, then maybe our astronomical medical costs would go down? Like as far as my example with EpiPen, how it's driven up like 4 times it used to be just because you can get away with charging more. People need it that badly.
Yeah, my understanding of EpiPen is that the company that makes it has a monopoly on it, and therefore there is no competition. There is no alternative to EpiPen, as far as I understand, that could be a cheaper alternative and would, force EpiPen to bring their prices down in order to compete. So they can name their price, and that is unfortunate. And I feel very badly for people who need EpiPens, or insulin, or any number of drugs in this country that the prices are astronomical.
Yeah, I mean, it's definitely just too expensive right now. Like I said earlier, at least 500,000 Americans declare bankruptcy due to their medical bills.
Yeah.
So I definitely think that universal health care would be life-changing for millions of Americans.
Okay. Let me ask you this. Can you name one program that the government runs well?
Well, I think public libraries are run pretty well.
Well, that's not the federal government. I should specify the federal government.
Okay, so I see the point you're making.
Right. And that point is, I just don't trust them. I just don't trust them. And I definitely don't trust them when it comes to healthcare. I would just rather open up competition, open it up to the markets, and trust businesses that want to make money rather than the government. Do you know what I'm saying?
I know what you're saying. And I don't hate that idea. I mean, maybe that could be the change that we need, because we for sure need a change. But I also think that if the government is taking full responsibility for health insurance, that doesn't mean that the medical knowledge that we have in this country, that our technology, that our capable doctors and nurses and healthcare providers overall are going to become less capable. Going back to your other point of how we are, leaders in treating breast cancer and all of that, our our know-how isn't going to suffer just because our coverage has changed.
Okay, I see what you're asking. I don't mean that our doctors are going to get worse overnight. That's not going to happen. But in the field of medicine, it's an ever-growing, ever-changing field, right? They learn new stuff every day, better practices all the time. And so without price competition from private insurers, the government is going to be free to pay whatever it wants for health services. They do this right now with Medicare. And decreased reimbursement will also prevent hospitals from investing in new healthcare technologies or trying innovative new therapies. So in a way, it may stop the processes we have right now of learning new and different methods to become better, and how, the United States became the best in healthcare in the world.
Mm-hmm.
Do you see what I'm saying?
Yeah, I do, and I think that's, a solid point. I think that so many of our arguments are black and white of, like, this is how it would go, and it's so gray. Like, we don't know what America's version of universal healthcare is going to look like, and whether or not there are, grants or funding opportunities once things become more universal that would still motivate us to keep getting better and better, because in the US we're pretty competitive and we want to do better and have more progress than other countries. So I think, like, we're not going to lose that motivation, and there would be incentive for creating this program to still give incentive to, like, specific research facilities and hospitals.
It's possible, hypothetically.
Isn't this all hypothetical?
Oh, it's all hypothetical. Even Bernie Sanders doesn't know how to pay for his own plan, so everything is hypothetical. Now, you had a point earlier about how America is the only country, or the only
first world country that does not have universal health care.
Right. Yeah, I don't care. Ultimately, I just, I don't care what other countries do. In the UK, they have a TV tax. And so we don't have that here. Should we have it because they have it? No. So, no, I don't really care what other countries do.
Okay. Well, I think we can agree that there's no perfect formula on universal health care yet. But we definitely need to improve what's happening here.
Yeah, something's got to give. We all agree on that. I think everyone in this country agrees that the system needs work, and that is putting it lightly. We just disagree on how to accomplish that. And there's going to be plenty more discussions about this topic going forward from politicians, and, we just wanted to address it and get our point of view in today.
Yeah. And that's what we did.
We sure did. Thank you, everyone, for listening to the Great Compromise podcast. Follow us on Facebook and Twitter, and we will see you next week.